Anticoagulants will be the next drug category I'll be covering. Anticoagulants are given to patients at risk of developing clots. Anticoagulants are also given to prevent clot enlargement or fragmentation. These drugs do not dissolve clots. Uses include patients with pulmonary embolus, myocardial infarction, CVA, deep vein thrombosis. Categories of anticoagulants include heparin, warfarin, and antiplatelets. Heparin, it blocks the conversion of prothrombin to thrombin, which prolongs clotting time. It must be given parenterally, either IV or sub-Q into the abdomen, at least at 2 inches from the umbilicus, belly button. Heparin is destroyed by gastric juices if given PO, so that's why you don't give it PO. The antidote for heparin, very important, is protamine sulfate. You're going to want to have a PTT, or a partial thromboplastin time, or APTT, an activated partial thromboplastin time. These are done to monitor heparin administration. Therapeutic levels are considered to be 1.5 to 2 times control values. Platelet counts should be monitored every 2 to 3 days because of the possibility of thrombocytopenia, and monitor hematocrit for evidence of bleeding. Warfarin, also known as Coumadin, blocks prothrombin synthesis. Warfarin is given orally, and its antidote is vitamin K, very important. Prothrombin time should be monitored. When warfarin is being administered, the PT should be 1.5 to 2 times the control. Results may also be reported in the INR, which is the International Normalized Ratio value. The INR results are independent of the regions or methods used. Continuing with the anticoagulant drugs, we have antiplatelets. Antiplatelets prevent platelet aggregation and thus decrease clotting. As you know, platelets are the glue that keep clots together. There are 4 drugs in this category. There's Repro, which is used for cardiac ischemia and in clients who have had percutaneous transluminal coronary angioplasty, also known as PTCA. There's Persantine, which is used in thromboembolic conditions. There's Ticlid, which is used for patients with intermittent claudication and sickle cell disease. And then there's good old aspirin, which is used to decrease the risk of MI. For all anticoagulant drugs, heparin, Coumadin, and antiplatelets, these adverse effects for these include bleeding, which is the primary adverse effect to watch for. As a nurse, you should assess the patient for bruising, hematuria, and bleeding from the gums. Also, drug interactions are possible. Do not give salicylates with anticoagulants unless ordered. Salicylates have an anticoagulant effect. Sometimes small doses of aspirin are ordered to reduce the dose due to Coumadin. Barbiturates, corticosteroids, and rifampicin are examples of medications that may increase the effects of warfarin. Amiodarone, cimetidine, and many antibiotics are examples of medications that may enhance warfarin's effects. So basically teach patients to not use any of the drugs while on anticoagulants without first talking to the physician. Avoid large quantities of vitamin K foods such as spinach, broccoli, liver, and tomatoes, as these foods decrease effects of anticoagulants, especially warfarin. As you know, vitamin K is the antidote for warfarin. And for patients who are going into surgery, they're going to want to have their anticoagulants discontinued 2 weeks prior to the surgery, unless specifically stated otherwise by the physician or surgeon. And with all these patients, monitor heart rate and blood pressure. The last category I'm going to cover in this video is thrombolytic drugs. Thrombolytic drugs, thrombolytic enzymes are used for the lysis of thrombi obstructing coronary arteries in acute myocardial infarction, lysis of pulmonary emboli, venous thrombosis, venous catheter occlusion, and stroke caused by thrombus or embolus. There are 3 drugs that I'm giving as an example for thrombolytic drugs. There's activase, streptase, and urokinase. The adverse effects for these drugs include bleeding, of course. It's contraindicated in patients with active internal bleeding or conditions in which bleeding may occur, and you're going to want to monitor for bleeding when on these drugs. Heparin therapy may be started following a treatment of a thrombolytic drug. When giving thrombolytic drugs for myocardial infarction, they should be given within 6 hours of the episode, otherwise it's really not effective. And when given for a CVA or stroke, it should be given within 2 hours of the episode in order for it to be effective.